Thank you so much for having me. It's an honor to be here. Thank you all for being here. I'm excited to share with you about Mom Power. So first, before I tell you anything about what Mom Power is or why it was developed, I like to tell the story of how I got to be right here in front of you sharing Mom Power with you. And that story began at the University of Michigan when I got to work with two women, Maria Music, who is a perinatal psychiatrist, meaning she has expertise in working with women during pregnancy and postpartum, and especially women with trauma histories and mental health difficulties. And then Kate Rosenblum, who is a child psychologist with infant mental health expertise. And what that means is that she really understands child development, the impact of trauma on child development, and the importance of supporting parents to support healthy children. And so Maria and Kate got together and really identified that there was a huge need. They were seeing all these families suffering. They were seeing a lot of women who were coming in for mental health problems, such as anxiety or depression, but really those were coming out of a place of trauma. These women had had abuse in their childhoods, had been in abusive relationships in adulthood, so just a lot of trauma and not a lot of resources to serve these mothers and these young children. And so Mom Power really came to be out of this noticing of a need and wanting to meet the need. And while I spent 2 years there on my postdoc fellowship working with Kate and Maria, they were gracious enough to train me in the model, and then when I moved here, to let me bring it with me. So I really like to share that story because I feel so much gratitude for them really building my roots as I learned about the model and then letting me branch out with it as I brought it here. And you'll learn more about what that language means, building roots and branching out, as I talk. So first, I want to just do a very brief introduction into risk that can surround motherhood. Now, I could talk to you for hours about this, and I'm going to condense it into about 60 seconds. So motherhood, pregnancy and postpartum, when everything is normal and healthy, is still a risky time. Hormonally, there's changes. Physically, there's changes. If you just think about having a newborn baby, there's a ton of changes when it comes to your routine, your stress, your sleep. You know, when you're pregnant, everybody's giving you a lot of attention and support, and then the baby comes and everybody's giving the baby a lot of attention. So pregnancy is just a stressful time. It can be a great stress, but it's stressful. And then if you add any other risk factors on top of that, it really can complicate things. So one thing to hold in mind is perinatal depression. And when I say perinatal, I mean surrounding pregnancy and postpartum. A lot of people think postpartum depression, but really the risk begins the moment a woman becomes pregnant. And about 1 in 4 mothers will have some perinatal depression symptoms, and about 1 to 2 out of 10 will have clinically significant depression during the pregnancy or postpartum time. It's relatively common. Again, hormonally, there's a lot of vulnerability. Physically, emotionally, there's a lot of vulnerability, so it makes sense. Yet, not a lot of people know this or talk about it. So now you know. Unfortunately, trauma is relatively common. 1 in 2 women, adult women, report some form of unwanted sexual experience during their lifetimes. And about 1 in 4 women are survivors of interpersonal trauma, so that being physical abuse, sexual abuse. And then unfortunately, a subset of women experience trauma during their pregnancy. So up to 1 in 3 women who are currently pregnant will report that when they were growing up, they experienced trauma. And then about 4 to 8%, which is a substantial number of women, almost 1 in 10 women, will experience some kind of intimate partner violence. And that's just the new word for domestic violence, recognizing that somebody that you're in an intimate relationship with is being aggressive towards you during pregnancy. And so that can complicate things. And for these women who have trauma histories, a subset of them will show worsening symptoms of PTSD or post-traumatic stress disorder across their pregnancy and postpartum period. And then it's important to think about sociodemographic risk. So this is all the stuff that surrounds us and who we are and the environments we live in. So things such as being low income, being a single mom, being a teen mom, having a lower educational status, which then relates to your income and your ability to kind of move throughout systems supporting you. All of those things combine into what's called sociodemographic risk. And if you have those types of risk factors, you're just at greater risk for everything else I just talked about. You're at greater risk for experiencing depression, and you're at greater risk for experiencing maltreatment. So really holding those factors in mind. You guys probably have heard a little bit about adverse childhood experiences, or ACEs. This is a word that's being used a lot in Tennessee right now because there's a big governor's initiative to draw attention to this. And so I briefly wanted to touch on, these are the categories of ACEs. And this is the idea that the stuff that happens to us when we're young impacts our developing brains and impacts our health as adults. It's relatively common. Most of us have at least one ACE, or adverse childhood experience, so it's not that these are uncommon things, but what the research shows is that the more ACEs you have, or the cumulative effect of ACEs, the greater risk you have for experiencing physical health problems and mental health problems and substance abuse. And so the categories are abuse, so physical abuse, emotional abuse, which I think folks forget about. This is when somebody that's supposed to be taking care of you and keeping you safe is consistently and chronically sending you messages that you're not lovable, that you're worthless, that you're bad, that you're flawed. Lots of yelling, lots of blaming. I think people forget that words can hurt and really cause psychological damage. And then sexual abuse. Then there's neglect. Physical neglect is when somebody doesn't have the food or safe shelter that they need. And emotional neglect is when somebody's supposed to be meeting your emotional needs when you're growing up and they're not able to. And then other things such as household dysfunction, so having a caregiver who's mentally ill, having a caregiver who is incarcerated, is addicted to substances, divorce, or really separation from a primary caregiver can be an adverse childhood experiences, so holding those in mind. And then these adverse childhood experiences, or ACEs, tend to get passed from one generation to the next. And that's called the intergenerational transmission of risk. And what that just means is that if it happens in your family growing up, it's more likely to happen in your family as an adult. So the greater the ACEs, the greater the risk for parental mental health problems such as depression, PTSD, substance abuse, exposure to violence, more likely to get into abusive relationships as adults, physical health problems, poverty, and social isolation. And then if you're a parent and you have a child, that child is automatically exposed to some ACEs. They're exposed to a parent maybe who's addicted to substances, or a parent who's struggling with mental health, or they're exposed to violence. And so then that child is more likely to grow up and have the similar problems. Another way of showing this is just when kids are exposed to poor parenting and/or abuse, recognizing that abuse is one thing, poor parenting is another, and there's a continuum between. But when kids aren't getting what they need when they grow up, they're more likely to grow up to have mental health problems and then have children, and then they're going to struggle with parenting. And then those kids are more likely to grow up and have mental health problems and then have children, and on and on and on. So what do? How do we break this? We try to offer interventions. We try to get in there and offer families something to break this intergenerational transmission of risk. But you can develop the best interventions and things still get in the way. So we have a lot of really great programs out there in terms of individual therapy and other ways that families could access services, but there's just so many barriers that get in the way. And Mom Power, this parenting intervention I'm about to share with you, was really developed holding these barriers in mind. So one thing, if you're a mom and you have kids, maybe one kid or multiple children, going to individual therapy is complicated because who's going to watch the kids? And especially if you're a single mom or a mom, who's struggling to pay the bills and don't have money for childcare. So childcare can be a barrier. So Mom Power accounts for this by offering childcare through what's called Child Team. And this is volunteers and a lot of trainees who are interested in child development and understanding therapeutic models of working with children. And they offer developmentally sensitive and trauma-informed childcare. And I say that with intention because it's not just babysitting, it's far more than that. And so really providing a safe and nurturing place for the children of the mothers so the mothers can come to group. Lack of resources, so just financially not having support to be able to go places and afford things. And so Mom Power, when it can, tries to offer monetary incentives for coming. And a lot of times this takes the form of offering help with transportation. So especially in this part of Tennessee, families live all over the place. There's lots of families living out in rural regions who it's hard for them to get somewhere. Even if they have a vehicle, the gas is expensive. And if they don't have a vehicle, it's even more complicated. So offering things such as gas gift cards or rides for these families and addressing those resources can help get families in the door. Mom Power also is really about connecting with community services. So if families aren't connected with other community services that can help support them, such as WIC, which can help with food stamps and offering things like diapers for the baby, Mom Power is really about connecting with those other community services. Now, remember, Mom Power was developed really to reach women who had trauma histories. And anytime there's trauma, there's a greater risk that somebody is really feeling ashamed or feeling stigmatized or different than. And so that can keep people from reaching out. Also, a lot of these families, if you go back through the generations, have had child protective services involvement for various reasons. And so they've learned to be distrusting of the system. They're afraid that if they talk to somebody, somebody's going to try to take away their child. And for some of them, this is based on real experiences of that happening. And so to address that, Mom Power's model is really designed to be warm and welcoming and non-judgmental. So really accepting folks where they are with a level of warmth and a very intentional, non-judgmental environment. So we're not, if mom's getting there late, we're not judging her and scolding her for getting there late. We're asking her how we can support her as she integrates into group. We also, the leaders, are trained to balance being warm and kind and welcoming, but also strong and in charge. And we'll talk about this in a moment, but that really parallels healthy parenting, that you need to have somebody who's in charge and strong and can keep people safe, but can also be warm and kind. And so the leaders model that throughout the intervention. Stress, anxiety, and mental health issues, by their very nature, keep us from going out. If I'm anxious, I might not want to leave my house. If I'm depressed, I might not want to get out of bed. If I'm stressed, I might think I don't have time for this. So the very things that we're trying to help with Mom Power are the very things that can keep the moms from coming to group. And so we really try to address this through the intervention by teaching moms evidence-based self-care skills, which I'll talk to you about in a minute, and really incorporating strategies from our evidence-based therapeutic models, such as cognitive behavior therapy, dialectical behavior therapy, and infant mental health. Poor social support can be a barrier. A lot of these moms, when I reach out to them, say, I don't really trust other women, or I don't really have anyone supporting me. So there's a lot of anxiety and isolation for these moms who are struggling. And so Mom Power is a group intervention. The very nature of the group offers these moms an opportunity to connect with other mothers. So we offer social support through the group itself. We also, it's a 10-week intervention. In our 8th week, we encourage the mothers to bring a guest, somebody who supports them in parenting. Sometimes this is a co-parent, such as the baby's father. Sometimes this is their parent, the baby's grandparent. Sometimes this is a home visiting nurse, somebody from church, somebody from the neighborhood. Really, the idea is that it takes a village to raise a child, and we want to support that by inviting their significant others and their support system into the group. Again, we recognize that past or ongoing trauma can be a barrier to reaching out, and so the curriculum itself is trauma-informed. And you'll see how we integrate that in a little bit when I show you an example of what we teach the mothers. And then again, really working to create that safe environment for these families. And then to address the mistrust or the bad experiences they've had with other healthcare providers, we start week 1 with group guidelines that the mothers themselves create. So empowering the moms to say what they need to feel safe, and then reinforcing that through honoring what they need to feel safe through group guidelines. We also offer confidentiality, and we create that non-judgmental environment. So the goals of Mom Power are really to engage these mothers. For a lot of these moms, they've had trouble connecting with the services that they need, and it's hard just to get them in the door. So it's really meant to get them in the door. To offer a brief intervention, it's not meant to be the first and last, well, maybe it's the first, but not the last intervention that these families get, but really to give them a positive experience of working with community-based providers. And then to refer them on to other services. For a lot of our families, maybe they need a home visiting agency to come in and support them, but they've been too worried that that person would refer them to child protective services. So sometimes by the end, we're able to connect them to those types of services, whatever they need. For the moms participating in Mom Power, we hope they'll be able to engage in the intervention. We hope they'll learn some strategies for coping with stress, and we hope they'll learn some strategies for parenting with kindness and strength. It's a 10-week intervention that was developed at the University of Michigan with research in mind. So from day 1, It's been embedded within a research protocol and within the community. So this wasn't tested in a university, this was tested in community clinics near and surrounding Ann Arbor, Michigan, with data collection around it to understand if it's working and for whom. And so with that, we have an individual session before the group ever starts, and this serves two purposes. One is to get research data, to get a baseline. How are these moms doing? Kind of who are these moms? What are some demographic variables? What's their parenting stress like? What's their depression like? What's their post-traumatic stress like? We do observation of parenting, so we have them play with their child and videotape it and code it to look at how sensitive their caregiving behaviors are. Things like that. Also, clinically, it's really important to engage moms on a one-on-one basis before you ask them to come to a group. So this first visit also serves as a clinical engagement where we're getting to hear the mom's stories and connecting with them before we ask them to approach a larger group, which can be anxiety-provoking for them. Then we have the 10 weeks of group. Halfway through, we do an individual check-in with each mom where she's getting to meet with one of the group leaders, and we check in on how it's going for her, how she's moving toward her goals, any difficulties that she's having in understanding the curriculum, and how we can support her and her family. And then afterwards, we have an individual session following the 10 weeks of group where, again, we check in on how it's going. We get some qualitative information about mom's experience in the group, and then we also get some post-data collection about parenting and parenting stress and mental health, and the sorts of things we're hoping will change with the intervention. There's 5 core components to the Mom Power intervention. The first is really to provide psychoeducation, so really to empower moms through teaching them what healthy parenting looks like and what healthy attachment based parenting looks like. So offering them information about what is attachment, what is child development, how do we hold these things in mind to meet kids' needs. We teach self-care practices. Again, this is to help recognize that we can't take care of others, including children, if we're not taking care of ourselves. The self-care practices are also meant to help lower parenting stress so that they can engage in the parenting behaviors that we're asking of them. We offer opportunities for practice with parent-child interactions and really hands-on application. So it's not just sitting and talking, it's doing. We do a lot of practice with the mothers and the children. We connect to services, which I've mentioned through the referrals, and then we enhance their social supports. So here's what a typical day looks like at Mom Power. We start with a meal, and this is to meet basic needs. A lot of these families, again, might have lower resources, and so we want to make sure that we're kind of meeting the needs. If we are hungry, we can't learn. Also, breaking bread with people is a really nice way to create a group cohesion and to connect with people. There's something just really humbling and connecting about sitting down and eating together. And so we start with a shared meal together. This also enhances social support. It gives the moms a chance to talk to each other. We talk about highs and lows from the week, so really building that social connection. Then we do separation. And this is when we separate the moms and the kids. Moms go to mom class, kids go to child team class. And we want to recognize that separations can be hard for children. When we're taking the child away from their primary caregiver, the person that is supposed to be keeping them safe, this can be stressful. And so we, from day one, create a routine around separation to start to model to these mothers that they can use routines to help make hard times easier. And so we all gather up for circle time and sing a goodbye song to recognize that separation. This also gives the leaders an opportunity to observe what the mom is doing with her child during that time and how she navigates that stressful time as one example of how we can help support her practicing the skills that she's learning. Then we go to class. And then after class is done, we have reunion, which again is another opportunity to practice skills, recognizing that class is 105 minutes, so a little over an hour and a half. It's a long time for young children to be away from their parents. And so we recognize and help coach the moms around how to be sensitive when they're coming back and reuniting with their child and how to apply the skills that they're learning in group at that reunion. Then we gather up and have circle time, which is when we sing developmentally appropriate songs and kind of really just support these moms in engaging with their children and playing with their children. A lot of these moms, had hard childhoods and didn't necessarily have anyone playing with them and delighting in them. And so circle time gives them an opportunity to experience that in a supported way. And then we say goodbye, and we honor that this is another separation at the end of group when the families leave for the week and they won't be back until the next week. And so for some families, this is the safest and most stable place they have to be all week. And so we want to recognize that transition through a routine, and the routine is we sing a song, a goodbye song. There's lots of singing at Mom Power. The curriculum, it's a manualized curriculum, and it really holds onto an attachment framework, so modeling how to see and meet attachment-related needs, giving moms a chance to understand child behavior, so what is children's behavior telling us? Using real-life examples, there's lots of anecdotes in the manual about children that come from real-life examples, but more often than not, we're using the mom's examples of their children because that's more applicable. We do guided self-care each week, so we aren't just telling moms to go home and do self-care, we're practicing what we preach in class with them. And then we do group practice and take-home homework each week to really help them apply what they're learning outside of group. The Mom Power Tree. So this is really the framework on which Mom Power is founded. And this is a model that we use throughout the curriculum to help moms understand children's attachment-based needs and how to meet those needs. So this tree represents the way that children grow and learn and thrive. And it recognizes that in order to grow strong, just like a tree, children need strong roots. And to build roots, they build roots through building connections with safe people in their lives, such as mothers or caregivers. And when a child needs connection, this is usually when a child is feeling a hard feeling, maybe sad, angry, scared, and they need somebody kind of bigger and stronger to connect with them and support them. And so the words in orange are what we can do when we recognize that a child has a need for connection. So we can offer nurturance, we can help restore emotional balance, or we can repair a disruption in a relationship. And the stronger and the deeper the roots grow, and the healthier the roots, the bigger and the stronger the tree can grow and branch out. And branching out is exploration. Exploration is how we learn. Kids learn through exploring their environment. When children play, they're exploring. And when children play, they're learning. And really, when kids are exploring, what they need from us is for somebody to attend to them, to notice them, to watch them, to help them, and to enjoy them or delight in them. So watching children kind of branch out or explore and learn, but being present. So not just kind of letting them go and not noticing, but letting them go and watching and supporting and helping when needed and delighting in their growth. This tree applies to all of us. It's not just a kid thing. It's really a human thing. And it might even be other animals, but I don't have the time to think through that right now. But really, this attachment system is all about kind of when we have our needs met, then we can grow in healthy ways. Healthy attachment in childhood predicts a lot of healthy outcomes later on. It predicts kind of mental health outcomes, being a strong leader, having better social skills, being independent, being able to resist peer pressure. So lots of the things we want to see for children comes from a healthy attachment relationship when they're young. That being said, it's not deterministic, meaning if you kind of are thinking about this and thinking like, no one did that for me when I was young, it's not a like one-size path. These things can change, and really what we know is that even if somebody doesn't have a healthy attachment with their primary caregiver, if they have it with somebody else, if they have a healthy relationship with somebody else, that can be really protective and help buffer and still put kids on that healthy path towards good outcomes. Why a tree for this metaphor? Lots of reasons, but some are that it's flexible. Trees are flexible, they're resilient, they bounce back. If you look outside right now, a lot of the trees dropped all their leaves for winter because winter is a time of adversity for plants, and now they're starting to bud again. They can grow strong, they can survive in harsh climates and weather storms, but when there's harsh climates or storms, they go back to the roots. And that's true for us. When we're going through hard times, when we're going through hard transitions, when we're experiencing stress or loss or depression, those types of things, we go back to the roots. And once our roots are nurtured, then we can branch out again. Trees can also be transplanted. You can move a tree, but they become more vulnerable during that time, and again, really need to focus on the roots to grow. Wondering and response wheel. So this is a tool we use with the moms to really empower them to get curious about how children's behavior can communicate what's going on beneath the surface. So child behavior is how kids communicate, especially before they have language, but even after they have language. Children communicate what they need and what they're feeling through their behavior. And so the wondering and response wheel is a way to take this abstract idea of the tree and attachment stuff and get really concrete about, okay, but what do we actually do? And so we start, I don't know if I have a pointer. We start in the green with behavior. So really teaching and empowering moms to notice objectively what the child behavior is. A lot of times when we see child behavior, we jump straight to assumptions. So if I see a toddler throwing a tantrum in the grocery store and I'm a stressed out mom and it's my toddler, I might think they're trying to embarrass me. And so that's jumping straight into like my mom brain, right? Like my embarrassed mom brain is like, they're trying to embarrass me. They want me to have a terrible day. Like, why are they doing this to me? And so this tool slows down the process and really encourages moms to kind of put themselves in the child's shoes. So first, what is the behavior? If it's a tantrum, the behavior is maybe stomping, crying, screaming, hitting. I mean, there's lots of behaviors. And then the next question is, what might the child be feeling? So again, if I'm a mom and I'm stressed out and I go straight to like, I'm embarrassed, therefore my child is trying to embarrass me, this slows me down and now I'm thinking, okay, what is my child feeling if they're throwing a tantrum? And I start to get curious about the emotion that's behind the behavior. And then the next question is, what do they need? Is this a branching out moment? Are they exploring, learning, playing? Or is it a building roots moment? Do they need connection? And if they're throwing a tantrum, I'm gonna guess maybe they're angry, maybe they're hungry. And what do they need? Well, if it's a building roots moment, if you remember those words at the bottom of the tree, they were nurture, restore, and repair. And right now I can tell my child is out of emotional balance because they're throwing a tantrum. So they need me, the bigger and stronger caregiver, to help restore emotional balance. And then how can I meet that need? And with this wondering and response wheel, we really stress that being a good parent or caregiver isn't about getting it right. It's not about being able to read your child's mind. It's about being curious and being persistent and being willing to go around and around the wheel if it doesn't work the first time. So we're gonna practice.
I'm sorry, I have a question.
Yeah.
Right now I'm an RBT at a registered behavioral tech.
Okay.
So what we generally do in that type of behavior, we do look at the antecedents of the environment to see what could be causing that behavior. But we also want to be careful about not, what's the word I'm looking for, not wanting to support or encourage that behavior further either.
Right, so you're approaching your work from a behavioralist lens. This intervention is based in attachment theory. So slightly different frameworks that take different approaches to understanding and responding to child behavior. One thing we do really try to support the moms around is how all emotions are okay in kids. We can validate an emotion and be empathic around an emotion, and yet behaviors need limits. So how do you balance validating emotions while still setting limits around the behavior? So it's not that we're gonna just let a child have a tantrum and not have consequences, but it's that we're gonna try to be curious about what emotion is behind the tantrum so that we can build empathy and something called reflective capacity, which is this idea that parents can reflect on their child's inner experiences, such as their thoughts and feelings and motivations, and then use that information to guide behavioral decisions.
Okay. Yeah.
All right, let's see if we can get this video to play. So I'm gonna show you this video. This is a video we show with the moms when we're teaching the wondering and response wheel, and I'm gonna pause it along the way just like I would in a mom power class and ask you all to answer some questions. So look alive.
This is Max. He's 3. A big boy like Max wants to be independent. Most of the time, Max is happy, but sometimes...
Okay, thanks for hanging in there with me.
he's feeling.
Okay. What is Max doing? So if we go to that behavior box, what is the observable behavior that he's doing right now? He's exploring, but like literally what is he doing? He's touching everything. Is this a branching out or a building roots moment? A moment to explore or connect? Branching out, explore. He's exploring. What might he be feeling? What emotions might he be feeling? Excitement, curious. Okay. And what does he need if he's feeling excited and curious? And I'll give you a clue that if he's branching out, we can use those words at the top of the tree, enjoy, help, or attend. What do you think he needs if he's branching out and feeling curious and excited? Attention. He needs attention, yeah. So someone to notice him.
To share his joy.
To share his joy, so enjoy it with him. You're touching the vegetables. If you're a parent that doesn't want your child to touch the vegetables, he might need help with a limit of like, oh, we look with our eyes, not our hands. So we can help and still set a limit. Maybe he needs help labeling. Oh, that's the, I don't know, lettuce, broccoli, I can't see that. So labeling, giving name to what he's touching. Good job, guys. All right, we're gonna keep going.
After all, he's busy learning about his world. There's so much to handle, sometimes frustration takes over. And tired and hungry, and that's when a meltdown happens.
All right, what is the observable behavior? What do you see Max doing? Stomping. Crying. Okay. Crying, stomping. He's like flapping his hands, plops on the floor. What do you think he's feeling? Frustrated?
Probably overwhelmed.
Yeah, overwhelmed. I don't know about y'all, but grocery storms overwhelm me. All the bright lights and people. Overwhelmed, frustrated. Is this a branching out or a building roots moment? A moment to explore or connect? Connect. He needs connection. So what might he need if it's a building roots moment? He needs connection. And we've got nurture, restore, or repair. Help restore emotional balance. Yeah, definitely. So let's see how mom tries to meet that need.
What can you do?
Mommy's here. Mommy's here, bitch.
Stay close. Let him know you care. You're showing him his feelings count. And remember,
How did mom meet Max's need for connection? What did she do or what did she say?
Mommy's here.
Mommy's here.
She stopped shopping.
Yeah.
For a moment.
Yeah, she picked him up and kind of stopped what she was doing so she could help restore his emotional balance. What did you notice about her tone of voice? Calm, patient. So when kids lose, well, any of us lose emotional balance, to help restore emotional balance, it's really important that somebody is more balanced. Somebody is calmer and gentler and warmer. And so she was able to use a gentle tone of voice to help him with that. And then the attention and the physical touch were all ways that she tried to meet his need for connection in that moment. Balanced parenting is a concept from Mom Power that really just describes authoritative parenting for those of you who have learned about parenting styles. And it's this idea that generally kids do best with parents that are able to balance being warm and kind and strong and in charge. With warm and kind being that kind of nurturing, loving warmth, and the strong and in charge being limit setting, and being able to have rules and have clear consequences and follow through on those consistently. For a lot of our moms with trauma histories and mental health difficulties, they are on one side or the other. So maybe I have a mom who grew up in an abusive home where somebody was way too strong and in charge. And so now she associates rules and limit setting with abuse, and she doesn't want to do that. And so mom is really good at being warm and kind. She wants to give her child a new experience that she wasn't given. And so she's kind of responded to having someone being too strong and in charge, or in other words, abusive. Now she's really warm and kind, but she struggles to set limits, and she struggles to kind of be strong and in charge, which is something that kids need for healthy development. Conversely, sometimes I have moms who have experienced adversity and hard things, and that they've learned that if they're not strong and in charge, no one else will be. And so they've really developed a parenting strategy that is great at being in charge and strong. Nobody kept me safe. I had to be the one taking care of myself. I'm going to keep my child safe. I'm going to have strict rules. They're going to follow the rules, or else something bad will happen. And that's been developed for very valid reasons, holding that trauma lens, that the things that happen to us when we're growing up and in our past impact the ways we experience the world, including how we parent. And so it makes sense that that mom has developed a parenting style that is really in charge and strong. And yet with Mom Power, we want to encourage moms to notice this, to get curious about it, and to start to identify what it would look like for them to move more toward the middle in a way that feels consistent with their experiences and with their parenting values. I'm going to show you some videos that we show the moms and just treat you all as though you're moms in the group. So I'm not going to tell you what we're doing because I don't tell them what we're doing when I play this. What words would you use to describe that scene? Beautiful? Peaceful? Calm? How do you feel watching that? Relaxed? Okay. What words would you use to describe that scene? Intimidating? Anxious? Confusing? How did it make you feel? So I'm hearing anxious, confused, intimidated. Any other feelings? I should have made the volume louder. But scared? Yeah, scared, lost. So these are the videos that we use in Mom Power to introduce the concept of scary background music. And scary background music is a metaphor for the idea that what happens to us from our past, from our childhood, from our adulthood, anything in the past, creates the music through which we see and experience the world. And so if we've had really pleasant things happen to us, we might have pleasant, calm music. If we've had scary things happen to us, we might have scary music. In these videos, the scene stayed the same. The only thing that changed was the music, and yet it changed folks' experience of it, how they perceived it visually. Actually, had a mom yesterday, we just taught this in class yesterday, a mom tell me she thought the second video was faster because the music changed her visual perception, but it also changes our emotional perception of an experience. And so the things that happen to us create that music, and different situations and people can bring up different music for us. So if I had a childhood where we just had the Easter holiday. So if I had a childhood where Easter was a calm and pleasant holiday, and we had traditions and it's really nice, then maybe as an adult when Easter is approaching, I have pleasant music that tells me, oh, this is going to be a nice holiday. If I were a child that Easter was a really chaotic and stressful holiday, and maybe dad drank too much or mom and dad fought a lot, then Easter approaching might bring up scary background music for me. So depending on the experiences we have, that'll impact the background music through which we experience our day-to-day lives. And so in Mom Power, we talk about how our background music can impact parenting, and how scary background music can get in the way of being able to be warm and welcoming, strong and in charge. And so we try to empower moms to reflect on their background music, to notice it. This isn't a trauma therapy group intervention. This is a trauma-informed group intervention, meaning that we're not trying to treat the trauma, but we're trying to be informed and aware of how trauma impacts parenting and support moms around that so that they feel empowered to notice their background music and learn some strategies to help turn it down if it's too loud or too scary. We also talk about how the experiences that they're giving their child now creates their child's background music. And so we do an activity where we have them write down a message that they don't want to pass on to their child and a message that they do. And we have them tear up the one they don't and then think about how they're going to try to actually do something or say something to pass on that positive message to their child. In addition to kind of offering this lens, this trauma lens, we also teach those self-care skills to help moms find ways to lower stress, to lower those post-traumatic symptoms, and to be able to find their own emotional balance. So some of those self-care skills are deep breathing, progressive muscle relaxation, mindfulness, guided imagery where we have them imagine a safe place that they can go to, using positive affirmations or cognitive restructuring, so positive statements to the self, noticing negative self-talk and talking back to it with a more positive way of thinking. And then other creative media ways to express themselves, express their feelings, and recognize that they're worth taking time and space to take care of themselves so that they can take better care of their children. So now I'm going to switch gears a bit. I've told you about the Mom Power Intervention and what it is, and now I'm going to tell you a little bit about the research surrounding it that tells us kind of what we know about whether or not it works. So this data comes from the University of Michigan. They did a randomized control trial, which is where half the moms randomly were assigned to Mom Power and half the moms were randomly assigned to a control group. The control group for this study was that the moms got those first and last individual sessions, and they got all of the reading materials, so all of the handouts from Mom Power, without actually getting to come to the group. So that's the control. The sample that they had was a lot of the risk factors that Mom Power was developed for. So generally single moms, younger mothers, low education, low income, high rates of mental health diagnoses, and not really much service uptake. So only about a quarter of these moms had services at the time that they started this. This is showing PTSD symptoms and depression symptoms pre and post treatment. And here you've got the treatment group, so Mom Power, and here you've got the control. And what this is showing is that for women who had a history of interpersonal trauma, so again, the moms were really trying to target with Mom Power, that if they got treatment, they showed significant decreases in PTSD symptoms and depression symptoms, whereas the moms in the control group did not show that difference. Additionally, the research showed that for moms who got Mom Power, they showed reductions in bonding impairment, or in other words, better bonding with their baby and child after the group. They showed increased emotional responsiveness. So this is where we videotaped mom and kiddo playing for about 5 minutes and then coded that reliably, and then really looked at, did that change from pre-intervention to post? And for the moms who got Mom Power, they showed increased sensitivity when playing with their child. We saw significant changes in reflective functioning. You might remember I mentioned reflective capacity, that idea that I can look inward and notice I have my own thoughts and feelings and motives and needs, and my child has their own thoughts, feelings, motives, and needs, and that mine are not my child's are not mine. They're separate but connected, and we impact each other. And so we assess that through a semi-structured interview where we ask moms questions and then code those interviews. And for the moms who got Mom Power, they showed greater reflective capacity after the intervention. A subset of moms were gracious enough to get in an fMRI machine and let us scan their brains when they looked at pictures of their babies. And we found changes in brain circuits related to empathy and emotion regulation for the intervention group, but not the control. And all of these findings were contingent upon showing up. We found a dosing effect, meaning that moms needed to be at least 7 out of the 10 sessions to really benefit from the intervention.
Do you mind going to the previous slide?
I don't.
Oh, is it up?
I can go backwards.
Okay. Yeah, so could you tell us about this slide one more time?
Yep, so this is PTSD symptoms and depression symptoms, pre and post intervention for the treatment group versus the control.
So I guess my question is, the treatment group, the pre-treatment, there's a really high rate of people showing symptoms of PTSD, and if it was randomized, why not the control group?
Yeah, that's a great question. There were actually no significant differences between the treatment and control group at baseline in these variables. But I think what you're seeing is just the scale here makes it look like these would be significantly different, but they weren't.
Okay.
Yeah, ideally randomization helps make the groups equitable, but the researchers actually looked to make sure that the groups were equitable on symptoms at baseline, and they were.
Okay.
Yeah, a nice observation. All right, now what? Now that we know it works, what do we do? In Michigan, they're adapting a version for fathers. We recognize that dads are important too. Male caregivers are really important. And so they're doing a pilot in Flint, Michigan, with fathers and learning a lot. Like, dads don't like sitting around a table and talking about their feelings for 105 minutes, so they're doing more group-based activity building, so really cool stuff there. Michigan has an adaptation for military families to support families pre and post deployment called Strong Families. And they have an adaptation called Hearts and Minds on Babies, where they're teaching Mom Power to early Head Start teachers and the parents of the children attending early Head Start. Here in Tennessee, I've been here almost 2 years now and have been working to train providers in this region to implement Mom Power. So when I moved here, I was the only one who knew it and knew how to do it. And now I've got about 30 different folks trained in it. And I'm working to start to implement groups both locally and across the state. Also, something that's different here that we weren't really experiencing that much in Michigan is the higher rates of addiction in this region, specifically opioid addiction and then neonatal abstinence syndrome, which is when the babies of the moms who are using opioids during pregnancy are born and withdrawing from the opioids. And so this is a whole new frontier of trying to figure out if Mom Power has a role and a place kind of in helping support these families as they navigate addiction recovery and raising a child who had neonatal abstinence syndrome. So far in Tennessee, I'm currently running the second group. In Tennessee, the first group was in the fall. I got an RDC grant from ETSU, which is just small, mid-sized grant, a nice grant, thanks ETSU, to support this for this year. And with that, I was able to train those 30 community-based providers from a range of agencies, mostly in the Tri-Cities, but some from Knoxville and Chattanooga. So training them in the model of how to do Mom Power, and then really connecting. So Mom Power is meant to be in the community, run by community-based professionals. So really building relationships with community agencies. And some of my closest partners right now are Families Free, which is a faith-based community agency that serves women impacted by addiction and domestic violence. And so they've been really eager to learn the model and try to implement it in their agency. And other agencies, foster care agencies, community mental health, so Frontier Mental Health is interested and came to the training. So lots of folks around the community who work with children and families who are wanting to learn this and offer it in their agencies. And then, so the first group was this fall. We like to partner with places in the community where families can get to and where they feel safe going to. The university, I don't know about if you guys know this, but parking is terrible here. So like to offer a group here on campus would probably be daunting, confusing, and annoying to get here. So we really like to offer groups in places where families are already going or can easily get to. And so in the fall, Harvest Community Church in Kingsport offered us their space, and they helped with meals. And now Covenant Presbyterian Church in Johnson City is offering their space, their nursery, helping with meals and actually helping some with the child care piece. So really kind of integrating into the community so that it's in places where families can easily access. And I want to be clear that Mom Power itself is not a faith-based curriculum. Mom Power welcomes providers and families of all faith backgrounds and beliefs, and yet partnering with churches has been a really beneficial way to be in the community, to be easy to access, and to have folks who are willing to volunteer time, transportation, food, and space. And so it's been a really beautiful partnership. I'm going going to skip this. Some of our referral sources, I will tell you that. Who's actually referring to Mom Power? A lot of people. So I've got pediatricians are referring. Nurse Family Partnership, which is a home visiting agency out of ETSU Nursing, does a lot of referring. Community mental health folks know about Mom Power and referring. Hope House is a crisis pregnancy center in Kingsport that's been sending me a lot of referrals. Nice-Wanger Children's Hospital is starting to hear about it and want to send mamas our way. So lots of community-based referrals, meaning that the folks out there who are touching these families are learning about Mom Power and then sending them to me, and then I'm able to plug them into a group. Trying to. This is from our first group, just telling you a little bit about the moms that we were able to serve in our very first group in the fall. If you remember ACEs being those adverse childhood experiences, the mean number of ACEs for the moms in our group were 5.5. That's really high. There's 10 ACEs, and an ACE score of 4 or above really puts one at risk for experiencing a host of difficulties. And so really kind of reaching the moms who have had hard childhood experiences. Also, the majority of our moms were experiencing depression, so it wasn't an inclusion criteria. They didn't have to be depressed, they didn't have to have trauma, but just by the nature of the intervention and the types of referring agencies sending mamas our way, this is how our group worked out. So majority of the moms had depression scores above the clinically significant range. This slide shows attendance. So we had 8 moms across 10 weeks. Again, these are highly stressed, women with trauma histories and depression, among other things. So attendance is hard. It's hard to get these mamas to come, even when you're trying so hard to get them there. And yet we were really successful with attendance for this first group. So here, this is the week, so week 1, 2, 3, et cetera. And here is the percent attendance, with 1 being a perfect attendance, meaning 8 of 8 moms showed up. And so you can see that generally, we had really great attendance. I think the average was 8 point something, so meaning that on average, we had at least 80% of the moms showing up to group every week. And then here, this is actually by mother. So about, 43% of my moms had perfect attendance, 15% had 9 out of 10 sessions, 14% had 8 out of 10 sessions, et cetera. So just showing that we were able to get the types of moms we were hoping to get, and then we were able to engage them and keep them coming back. So feeling successful about that. All right, and with that, I'll say thank you for listening. Thank you to Michigan for developing it and all the families who've participated, and I will answer any questions you may have.
If I was wanting to maybe refer people to you through our agency, how would you what's your contact information available?
Yeah, thanks for asking. I'll give you a card. And I think, there we go.
I know several agencies that could use that service.
Yeah, so there's my name and email. And as it grows, I'm building a greater capacity to take referrals that includes graduate students and my community partners, but for now, I'm the gatekeeper, so send questions and referrals my way. Other questions?
Do you have any students presenting at FIT Student Research Forum today and tomorrow that you'd like to tell people about?
Thank you for asking. One of my graduate students, Meg Klingesmith is a grad student and she is presenting, but related to Mom Power, Rebecca Otwell is presenting at 2 o'clock today on some of the implementation efforts of Mom Power. And that Appalachian Student Research Forum is over at the Millennium Center. And it's a really great way to see undergraduate and graduate students involved in research and to learn a little bit more about research. Other questions?
In week 3 specifically, for the attendance, it was extremely low.
Uh-huh.
Was there a reason for
It's
that?
so funny. I know. People ask me that all the time. No, I don't know. It was right around Thanksgiving. I'm not sure what happened that week. I think, honestly, if I think about the moms who weren't there, it was like a host of like legitimate things. Like somebody had a pediatrician appointment. One of our moms was pregnant in that group and was sick. So generally, with that group, if they were able to come, they came. I think one of them had to work and couldn't get off work. But generally, more so than not, they were coming. Yeah. All right, thank you for being here and listening. Have a good day.